name's Ashlee Bates. I'm going to be the student nurse practitioner taking care of you today. What brings you in today?
My throat, my nose, my ear.
Your throat and your ear. Throat hurts on both sides or just one?
Both sides.
Both sides. Both ears hurt?
Just my left.
Just your left ear. Have you fever?
Moderate to low grade.
Moderate to low grade. Have you taken anything for it?
No.
No? Okay. What do you consider low grade? How high is your fever?
About 100.
About 100. Okay. Any cough?
Not really coughing.
Night sweats? Shortness of breath? Chest pain?
Not really.
Muscle aches? Any dizziness or trouble walking?
No.
Notice any weakness in your extremities?
No.
Any trouble with urination or stooling? Okay. Do you take any medicine on a daily basis?
I do. I take lisinopril.
Lisinopril.
High blood pressure.
And how long have you been on that?
For a while.
For a while. You pretty good about taking it?
Yes.
Do you measure your blood pressure at home?
No. I just take what the doctor tells me and
Okay.
go from there.
So you have hypertension. It'd probably be a good idea to start measuring your blood pressure at home just to keep a tracking of it and that kind of thing. So you have hypertension. Any diabetes, heart disease, lung disease, problems with your brain, kidneys? Okay. Any family history of diabetes, high blood pressure, heart disease, cancer? Okay. Alrighty. Have a tetanus shot? Yeah. When did you have a tetanus shot?
About a year ago.
Okay. What did you have that for? Just cuz or?
Work related.
You had an injury? Okay. Any surgeries?
No.
No? Alrighty. How about a flu shot this year? Had a flu shot? Okay. When did you have that?
A couple weeks ago.
2 weeks ago. Alrighty. Anybody around you been sick, have the same kind of symptoms that you're having?
No.
No? Did they come on kind of suddenly, or have they kind of been aching for a little bit?
No,
And then...
it just happened coming all of a sudden.
Okay. Alrighty. Are you a smoker?
No.
Okay. What about alcohol consumption?
Maybe 1 to 2 weeks.
1 to 2 a week. What do you drink when you do drink?
Beer.
Just a beer? Okay. Any illicit drug use?
No.
Okay. Are you married?
Yes.
And any children?
1 boy.
1 boy. Okay. Wife and children? Healthy? Okay. What do you do for your job?
I work outside a lumber company.
Okay. How about exercise?
It's enough exercise.
You're on your feet all day?
All day.
Okay.
Maybe 12 hours a day, so.
Alright. Alright, well we're going to take a look at your throat and see what's going on, and let me just wash my hands real quick. Are you allergic to any medication?
No.
Alright, so I have a 42-year-old white male that has come in today for a 24-hour history of bilateral throat pain as well as left ear pain, fever that has reached the Tmax of about 100. He has not taken anything for it. He does have a previous history of hypertension and takes medication for that on a daily basis. Lisinopril, do you know the dosage?
I think it's 20 to 25.
20, 25 once a day, and he claims to be very regimented on that. He does not take his blood pressure at home. We did educate on doing that. Has had his flu shot this year, has had a tetanus shot within the last 10 years, up to date on all the vaccines from childhood. Okay, so skin is warm and dry. The skin is warm and dry. I do not see any rashes. Have you had any rashes that you've noticed? No. Yeah, no rashes. And I'm just going to check the radial pulse. Radial pulses are 2+ and equal bilaterally. Just relax, I'm just getting your pulse count. Radial pulse is about 64 beats per minute. Can you squeeze my hand? Grip strength is 5 out of 5 and equal bilaterally. Do you have any pain here? Have you been having any headaches?
No.
Okay. Head is normocephalic and atraumatic. Just going to palpate the frontal sinuses. Okay. Okay. Frontal sinus palpated without pain. I'm going to palpate the lymph nodes. Occipital lymph nodes unable to be palpated. Posterior cervical lymph nodes unable to be palpated. Anterior cervical lymph nodes. There is a 1 to 2 millimeter mobile lymph node on the left anterior cervical chain. Does that hurt? It is non-tender to palpation. Submental lymph nodes unable to be palpated. Can you kind of roll your shoulders in for me? A little down a little bit. There you go. Supraclavicular lymph nodes unable to be palpated. Alright, I'm going to take a look in your ears and at your throat. Which ear did you say was hurting the worst? The left one? Okay, then we're going to start in the right. That way it's not painful for you. Auditory canal is clear. Tympanic membrane is pearly gray and intact. We're going to go over to the left. Does it hurt if I tug on the ear? No? Auditory canal is slightly erythematous, no edema noted. Tympanic membrane is erythematous but not bulging. Just going to take a look inside your nose. Have you felt any drainage? You go down the back of your throat? No? Nares are patent bilaterally, and I'm going to have you open your mouth, stick your tongue out, and say ah. If I had a tongue blade, I would use it to help keep his tongue down. So throat is erythematous pretty much all over. Tonsils are 1+. No pus pockets seen on the tonsils. Can you lift your tongue up? No other sores inside the mouth are noted. We're going to come around here and just listen to your chest. Just breathe normally. Take a deep breath in. Blow out as fast as you can. Once more. Come around to the front and just sit there. Respiratory rate is 14 breaths per minute. Breath sounds are clear and equal bilaterally. You said you didn't have any shortness of breath or coughing. Okay, so your lungs sound clear, so everything sounds good there. I'm going to have you lay down, put your head on this pillow for me. I'm going to have you, I would pull out the table if it was to extend for his length. Yeah, just relax, put your hands down to the side. I'm going to inspect your chest to see the precordium. Just breathe normally. You can actually see the precordium right here. I'm going to palpate it. The precordium is approximately 2 finger widths in size. I see no jugular vein distension as he's laying down. And I'm going to listen to his heart. And I'm going to start with the aortic area, which is at the second intercostal space on the right sternal border. And I'm going to go to the pulmonic area, which is at the second intercostal space on the left sternal border. I'm going to go to Erb's point, which is at the third intercostal space on the left sternal border. I'm going to go to the tricuspid area, which is at the fourth intercostal space on the left sternal border. And I'm going to go to the mitral space, which is at the fifth intercostal space at the midclavicular line. I'm going to count an apical pulse here. I'm going to listen to those 5 areas again with my bell for any murmurs or bruits. Left intercostal space at the right sternal border. Second intercostal space at the left sternal border. Third intercostal space at the left sternal border. Fourth intercostal space at the left sternal border. Fifth intercostal space at the left sternal border. Apical pulse was 64 beats per minute. S1 and S2 were heard. No S3, no S4, no bruits, murmurs were heard. And Erb's point, I did not hear a split at Erb's point. I'm going to have you sit back up. All right. Thank you very much. We'll be back in a minute.